Hello, I'm Dr. Bobby, one of the FI2s in the surgery. Am I speaking with Phyllis Marcy?
Yeah, doctor, I'm Phyllis.
Okay. Could you please confirm your age for me?
I'm 55, doctor.
Okay. And is it okay if I call you Phyllis?
Yeah, you can call me Phyllis.
Okay. So, Phyllis, I can see from my notes that you are here to know about your results. You had some tests done, am I right?
Yeah, doctor.
Okay, so I have the test results with me, but before I explain you your test results, uh, can I ask you some questions? Is that okay?
Sure, doctor.
Okay, so um, Phyllis, I would like to ask you what made you take the test in the first place?
I was feeling so tired, doctor. I can't do anything nowadays.
Okay, and since how long have you been feeling tired?
Maybe like last 2 weeks, 3 weeks max.
Okay, I understand. And other than tiredness, did you feel anything else in the last 2 to 3 weeks?
Like what, doctor?
Like any fever or any dizziness, any headache?
No, nothing, doctor.
Okay. And do you feel like your mouth gets dry or do you feel thirsty?
No.
Okay. Okay, Phila, so I would like to ask you some more questions. I can, so do you have any long-term medical conditions, like any
Um,
diabetes, blood sugar, or any medical conditions at all?
no, I have depression. Had for the last 4 months. Getting
Okay.
treatment for that. I'm doing well. That is fine. But yeah, this tiredness is just it's too much, doctor.
Okay. And so you said that you had depression for past 4 months. Did you take any medication for that?
Yeah, I'm taking this citalopram. Initially I went to therapy and all that, but
Okay.
that really helps, doctor. I tried, and recently this doctor placed me on this thing called citalopram, and yeah,
Okay.
it's been really good. I've been feeling so much better now, and
Okay.
I'm actually wanting to do things.
Okay. So why are you taking the medications regularly? Like you were prescribed?
Yeah, only once a day.
Okay. And you said that you are feeling better than before now, right? After
I
the
mean, better
medication?
in the sense my mood is better, but like this
Yeah.
tiredness, something that's I can't even get out of the bed. I wouldn't call it better.
Okay. Okay. I understand. I'm sorry to hear that. So is it okay if I ask you a few more questions, Phyllis?
Yeah,
Okay. So do you ever feel like your heart is racing?
no,
Okay. And do you have any problem with your bowels?
no,
Any problem with pee? Um, any, no? Okay.
no,
Do you have any tummy pain?
no,
Okay. And do you feel like you have any lumps or bumps anywhere in your body?
no, no, doctor.
Okay, okay, I understand. And what about your appetite? Do you feel like eating? Do you eat well?
Yeah, I eat well. I eat a lot actually. My kids
Okay,
make a lot.
okay. And do you exercise by any chance?
Where, doctor? I can't even get up from bed. How will I exercise?
Okay, okay, I understand. So, do you drink alcohol?
No,
Okay. And do you smoke?
no, doctor. Why will I do all that? I know I'm not supposed to do that.
Oh, that's good. That's good. I'm sorry, it's part of the consultation, so I need to ask that, okay? And by any chance, do you have any family history of any long-term medical conditions like any cancer or any high blood pressure or high cholesterol?
No, nothing.
Okay. And other than the citalopram, do you take any other medications?
No,
Okay. Do you have any allergies?
no.
Okay. And what do you do for work, if I may ask, Phyllis?
Doctor, can you just tell me the results? I just want to know the results.
Yes, of course. Of course, I will explain the results to you. I'm sorry if you could be a little bit more patient with me. Okay. So I have the results with me, and we have seen in the results that you have a low level of salts in your body. Okay.
Okay,
And okay, so that we found low level of potassium and sodium, and we believe that it could be due to the drug citalopram that you are taking. Okay.
okay,
Okay, it could be
okay,
a side effect. So, what I would like to do is that I would want you to stop the drug for now. Okay,
okay,
and we will send for some more blood tests. I will follow you up within 1 week's time. Okay,
okay.
and then we can see that if we can, if you feel worse. In the meantime, if you feel worse or you are feeling dizzy or too headache or generally too unwell, you should come to the hospital right away or call 999, okay? And I will
Okay.
also give you a leaflet regarding the side effects of citalopram, and we will see how you are doing after stopping the drug, okay? If needed, we
So,
can prescribe you another antidepressant after that.
so
How does
what
that
do I
sound?
do now? I can go home now. So, uh, what are you saying? I mean, I have to stop the medicine now and go home.
Yes,
That's the only thing that's helping me. I mean, I'm able to talk to my kids and I'm able to enjoy the TV shows that I used to enjoy. All that is
yes,
happening
I
after the.
understand.
I
Yes,
can't.
I understand.
I want to stop the medicine.
Yes, I understand that, but unfortunately, the drug is not helping you at the moment. It's making you more tired. So if you could stop it just for 1 week and we see how you're doing and get some more blood tests done, then we can start another antidepressant for you, okay? And I will also
Okay.
inform my senior about this. Okay. Sorry. Sorry, doctor, I talked too long.
No, no, no. That was good. That was good. That was really good. You did a lot of data gathering. That was really nice. But what do you think is your task in this station?
To take to discuss the results and discuss the management.
Exactly. So history is just one part of it, right? So I mean, I kind of pushed you towards it in at the 2 minute mark, saying, "Can you just tell me the results?" But if
Yeah,
in the exam they might not do that.
yeah, I understand, doctor.
Yeah, but it's really good. You need to you even within that 2 minutes also you said everything that's needed for the management, but you need to manage your time a little better.
Okay,
Normally what we tell is keep 4 minutes for data gathering and 4 minutes for management. So at 4 minute mark you need to somehow stop your data
okay,
gathering somehow,
okay,
right? Because
okay.
if you think about it, how many marks does data gathering carry and how many marks does management carry?
Yeah, so it's I guess it's 4 and 4 on each.
Exactly, right? So why are you giving so much more importance to data gathering here?
Yeah, yeah. Sorry, doctor, because I was just trying to find out like if
No,
he's getting tiredness for
I understand.
anything else. I
Yeah,
wanted to do
that's
that.
okay.
No, I get
Don't.
it. I should make it shorter. Yes, I understand. Yes.
Yeah. So always keep that in mind.
Okay.
That time is there. That you have to finish it somehow, right? Like I'll
Yeah.
pass it on to the examiner. She'll give you better feedback.
Okay.
Hi, Dr. Afrida.
Hello, doctor.
All right, so that was a great performance, I have to say. So I'm going to take you through a couple of things that you can incorporate into improving, your data gathering and trying to make it short, especially.
Okay.
So if you see, you had 1.5 minutes to actually contemplate about this case and understand how to approach it, right? So there were in this case, we've made it in such a way that all the clues, all right, so that you can come upon the structure like easily. This is one problem that a lot of people are facing, that they do a lot of data gathering and they don't get to management. So quite frankly, when you look at the question, there are a couple of things you are looking at. So you want to first understand what is the presenting complaint. Out of all the information, you have to understand what is the presenting complaint. So over here, she has depression for the past 4 months. That duration is given. She is on citalopram, but the duration of how since when she's on citalopram is not given. But she has been currently having tiredness. So this is the presenting complaint for the past 3 weeks, for which she has got blood test done. So if you look at it, I mean, the question itself is giving you an idea of what the presenting complaint is. Always understand what is the presenting complaint in the question. All right. And more than that, they have given you the blood test as well. All right. So if you look at it, most of it is normal until you come to
Yeah.
the sodium. So you know that there is a low sodium as well, right? This much information you have gauged from itself, right? Now you have to make this connection that she's having depression, for which she's taking citalopram, for which she's feeling tired, and on investigation you have found low sodium, right? Now this is the data that you have to gather from that patient. So in this question, we've given you an entire idea of what your data gathering should have been, but most of the points might not actually be there. Sometimes only just the fact that she's tired and she got a blood test done might be there. All right. So these are the important questions that you need to hit upon in this particular consultation, right? So now moving on to the consultation part. So now you entered. All right. So now as soon as you enter, you have to confirm a couple of things, right? So feedback is also here. Awesome. So yeah. Just hold on one moment. Awesome. So yeah, when you enter the cubicle, there are a couple of things that you have to do. Like you have to introduce yourself. You have to know the identifiers. Over here, you did it very correctly. You asked her name. But to save time, what you can do is you already have that information. So then introduce yourself. Tell her where you're from, and then ask her, if she is Phyllis Mercy. That will actually save you a little bit time, because that way you're not looking for a long response from her. So you can ask her, Phyllis Mercy, is it? Like, could you please confirm your age for me? So that way, that is your identifier. Once you've identified the patient, now you need to ask the related questions. So now, how do you introduce the presenting complaint? So you have all this information. So use it, paraphrase it, and use it so that your data gathering can be shorter. You don't have to ask every aspect of it. So just ask her that I can see from my notes that you have come with tiredness, and you've had it for the past 3 weeks, and you've got some blood tests done for it. Is that correct? And then she'll be like, yeah. So then explain your role, why you're there. You will probably be explaining that I'm here to discuss the results with you, and then move on to expanding about the presenting complaint. So ask her, could you tell me a little bit, start with an open-ended question so that she can tell you all about it in the beginning, how much ever she can. So ask her in an open-ended manner, saying, could you tell me a little bit more about this tiredness? So let her say whatever she wants, and then start going into the close-ended questions. And in the close-ended questions, what you're trying to understand is how long the tiredness has been. You have to get that fact right. And then why do you want to understand this is because tiredness, if you can see in this tab, can be caused due to multiple things. So hyponatremia, multiple myeloma, leukemia, essentially all the anemias, Addison's disease, hypothyroidism, OSA, and chronic fatigue syndrome. So this is also very interesting case. We'll have this one day. All right. So you have all these differentials in your mind as soon as you're in the cubicle and you understand, as soon as you're reading the candidate information itself, right? So you have to rule it out. So by the duration, you can say that it's a relatively acute condition as compared to every other condition. They happen for a longer duration of time, the tiredness. So then ask related to that. So now you've narrowed it down to so many things, all the acute condition. So now you feel that it could be hyponatremia due to a medication. So that information has actually been given to you. So then use that, right? So you already have your diagnosis at this point, but you are trying to make that connection clear to the examiner who's coming and testing you, because all the questions you have to ask should be very related to your consultation. So that's why they call it like, what will say, like specific questions. I'm kind of blanking on the word. All right. So after that, when you get to the point of elaborating the tiredness, the important points that you have to elaborate for tiredness are the duration of the tiredness and the pattern of tiredness. Like, is it constant? Does it increase or decrease with rest or any activity? So that is the important aspect that you have to understand to rule out a lot of other things, right? You asked about associated symptoms like any bowel changes, any loss of appetite. Those are very good questions because you're actually ruling out one of the main major causes, which is a very dangerous cause for tiredness, which is cancer, right? Any kind of cancer can actually cause that. So you need to rule out your flaws. So that's one of the important associations that you have to rule out, and you have to make it evident to the examiner that you have ruled it out, because that actually acts in your favor. This in this way you're trying to display that you are a safe doctor, right? Now, so elaborate that tiredness, understand why, understand the aspects about the tiredness that can give you a better differential, right? And then once that is done, so mainly for data gathering, when you think of it like this, when you're gathering data, you're trying not to only treat the disease, but the person itself, right? So understand, like, how is this tiredness first of all impacting his life? Because if there is any information he tells you about that, you might improve it for him. And with this tiredness, how is he living? Does he have support? Because if you don't, if he, that's what, no, you're not only treating the disease, you're treating the person itself and his entire aspects about life. So that is what is important to gather as well with the tiredness. You are definitely coming to a conclusion on what this tiredness is, but you are also treating the person. So those important questions from data gathering need to be asked. So yeah, so when we're coming to that, so the important things to rule out, you actually can rule it out by just asking the right OD para questions. All right. Now, when you're coming to the PMAF TOSA to understand a little bit about his lifestyle, you have to start with, if he had any past medical condition for which you have the information in the question itself.
Just say the call will get ended. We'll rejoin the same call.
All right. So I think we have less than a minute left for this call to be ended. So we'll rejoin on the same
Okay.
call. Is that all right?
Okay.
Yeah.
Yes,
All right.
yes, doctor.
I'll just continue to the point where it gets disconnected. All right,
Okay.
so we were talking about the PMAF-TOSAs, right? So now in that PMAF-TOSA, before you actually go on to PMAF-TOSA, and by the time you start getting an idea of what it is due to, start asking nice questions. Because not only the fact that you are improving this condition for him, it could also be the fact that he has a misconception of what this condition could be, and you need to know that to rectify any thing that he is doing wrong. Maybe it's a lifestyle change he might. So right, so we were talking about the person, the more the data gathering that are important in these cases. So yeah, this is a counseling case as well, in a way, if you think about it, right? You are coming to a diagnosis and you're also counseling the patient about what has gone wrong, right? So now when you're explaining that, so that you have to understand the impact that particular side effect has had to his life. So the thing is, he is tired. So you need to understand the impact in the form of at home, in your daily activities, at your work, if there is anything, right? How has it impacted him, right? And does he have enough support system with all this tiredness? I know it might be difficult for you. So at no point are you actually, you never actually showed any empathy for anything that he's undergoing. So you should try asking them, like if he mentions that, yeah, I had depression, say, I'm so sorry you have to undergo that. How are you doing right now? Ask two depression questions in that context, in that particular context itself. You can start by, asking them how they're doing, and then if they say they're all right, then still ask about the mood and the anhedonia, because those are the ways you can actually quantify if the depression is there or not, or how much is the depression, right? So that can be like a very smooth transition, where it can be, oh, I'm so sorry you had to undergo that. How are you? Is the medication helping you? Because ultimately, you also know by the question and the data that you have gathered that it is probably due to citalopram. So you are thinking of using his medication. So you need to understand from him, is he how well the citalopram is working? Is he better? Because if you're telling him to change it, he might not be happy about that, because it's working for he doesn't want to go back to the state of depression, right? So you need to understand, you have to gauge his predict his reactions. Those are questions that you can ask, right? Potential questions that you can ask when you're talking about the PMAF-TOSAs. So PMAF-TOSA, you'll ask about the past medical condition. So ask it in a way where it's close-ended, in a way. Definitely in certain conditions when you're thinking about it, it's nice to ask I'm sorry, when you're asking, ask in an open-ended manner. But there are conditions where you may have to ask in a close-ended way, like so and so condition, when you're trying to narrow it down, right? The differentials. But in this case, you can ask, like, do you have any other medical conditions in the past? So then they'll talk about depression, like, I'm so sorry. And then you have that dialogue of conversation. And then they'll also say that I've been on citalopram. He's like, all right, how long have you been on citalopram? So that is what is answering this question. Like, she has had depression for the past 4 months, placed on citalopram. You don't know the duration. So this is a question you need to know, because you have to correlate the fact that the depression is, I'm sorry, the tiredness is happening at the since she started the citalopram. So that is you needed to make. So you needed to understand the duration of citalopram. So when you understand the duration of citalopram, you know that it can be due to that particular cause, because that's the event that has caused her to have depression. I mean tiredness, most probably, right? So this is the connection you have to bring to her. So at this point, try to understand what she thinks the tiredness is. Like, do you have any idea what this could be due to? Because she's been having it for 3 weeks, right? I'm definitely sure that she might be thinking that, no, one day she comes to hospital, like there might be something going on in her mind. So you need to explore that so that you can rectify if there is anything wrong that is on her mind, right? So then ask her the ice, like, do you have any idea what this could be? Do you have any particular concerns that you would like to share with me, right? Any expectations you're having from today's consultation? Right, you can ask the ice questions there itself. So with that, you would also it will also give you a structure on how to take the consultation, because there itself they tell you how it's impacting their life and their concerns and stuff, right? So that's a very important question to ask ICE. And yeah, so now once you've gathered so much information about the tiredness, what it could be, the PMAF-TOSA question about her support system and how it's affecting her life, now you have to introduce the blood results, right? Miss Mercy, like I told you before, I'm here to discuss the results that you've had in your last visit. So then initially explain all the results. Initially start with the good news, and then it's a general rule. I mean, there could be exceptions definitely, but start with the good results first, like the positive ones, and then however then bring in the the abnormal result. So start with, we had done the blood tests for checking your liver function, to see the oxygen carrying capacity and your immunity of your blood, and they seem all fine. However, we also did sodium, which is basically the salt content in your blood, which you did very good. Actually, you have to talk in a layman term to make them understand. You get points for actually talking in layman terms, right? So which you did which you did, and it has come out to be low, right? So now wait for once you've said, and this is called hyponatremia. Always say the diagnosis. You will get marks for saying the diagnosis alone. So when you say that, then wait for her response because you need to understand what they comprehend from it, right? Said a whole lot of things you have to understand. So that is a way to show that you are actively listening to them and you are having a real conversation, right? So you wait for their response to to gauge how they feel about what you just told them. So then she'll be like, yeah, how is that sodium low in my blood? And then you can bring the correlation in. Like, I suspect this could be because of the medication that you're taking for your depression. It has a tendency to have low sodium, which can manifest as tiredness or which can end up giving you tiredness. So that is probably why you're feeling so, right? So then
Okay,
they're
and should
like,
I have done any general physical examinations here, or it's
I
okay
mean,
that I didn't do it?
yeah, you can actually do general physical examination because you're trying to rule out anemia, right? Anemia as well as lumps or bumps of cancer. So think about all the differentials that you can rule out if you do it. So think like that. The question that you should be asking is if I do the examination, will I be ruling out any differentials, important differentials? So if that answers your question, then yeah.
Yeah, okay.
All right. So, yeah, because you already have a blood test, and like since you have so much to talk about in the management as well, you have to think about how it's fitting in. Will it be relevant enough? Have I ruled out the cancer enough? Should I do the general physical examination? But yeah, if it answers your question that any differential, if it rules out, definitely do it. Yeah. So yeah. So now so now you told her what this tiredness, this correlation, and everything is, and you told her it's a low sodium condition, which is basically low salt, right? But more importantly, you have to admit this patient because she has an electrolyte um, what to say, disbalance. So if you
Okay.
see with the hyponatremia, she is almost in the moderate stage where it's weakness. But if the hyponatremia persists, she is going to go into a fit and a coma eventually. Do you understand?
Yes,
So
yes.
that's
So
what you
I
need.
should have admitted her to give fluids.
Exactly. So you have to identify the cases you need to admit and not. Any electrolyte disbalance, always have it in the back of your mind. You need to admit them. All right. So that is what you need to bring next. In this 8-minute consultation, you should definitely tell her about admission because you're not sending this patient home. So bring that in, say that this is what you're having, and for the treatment of this, we will have to admit you. Yeah, and then ask her permission. Could we please admit you? And then she'll give you a response like, if she says yes, very good. If she says no, then argue with her that this can actually lead to very serious consequences. So please, we will need to admit you, or else it can cause, coma. You can actually say that because it's true. And then you have to talk about the fact. So after you talk about the admission, now talk about what is causing it, how to change the medication. So now you've already told her that this could be because of your what is a medication. So regarding the cause for this, Miss Phyllis Mercy, we'll need to change your medication, or we might need to reduce the dose. You can give that option and then gauge her reaction. So then she'll be like, no, it's working for me. But like, yeah, I understand, but it's also giving you the side effect which can be life threatening, right? So how about we reduce dose and we monitor you and we see how how well you adapt to the dose change. Or else if that's not working, we need to change the medication altogether, right? The medication we might suggest is something called amitriptyline, which might have its own side effects. So we need to monitor that medication closely as well, right? So that much you've told her. That is the entire management. Now go on to the part where you're talking about the follow-up, leaflets, pamphlets, safety netting. So now you've already told her she's admitted, and you told her why this happened, and you've told her you're going to change the medication. That is what's most suitable, right? And then at this point, you have to say that how about I arrange the follow up with you to see how well you're doing with the change in the medication, right? It could be the dose that is changed, it could be the medication altogether. How about I also offer you some leaflets and pamphlets about this condition so that you would also know if anything is wrong. And finally, safety netting, and also do look out for all the things that hyponatremia can cause. So we have a whole lot of things: headaches, any nausea, vomiting, any muscle cramps, any confusion. If you feel you're feeling, please do come to the hospital immediately, right? So that will
Okay.
be like a way to approach this case in like a very compact manner.
Okay.
Yeah, I hope that was useful. So
Yes, of course, that was useful, doctor. Thank you.
you're welcome. So the main thing that I'm trying to bring out from this is you can start, structuring your consultation as soon as you see the candidate information itself. And that is an important 1.5 minutes. That's why on purpose we actually give you so much information for the candidate info, because you could have actually structured it so well, right? Because most of the time you have
Yes.
to ask questions. But over here, we are giving you that time to actually structure it on your own and actually see, have a smooth consultation. Yeah.
Okay. Yes, doctor.
All right. So you have your exam end of July, right?
Yes, doctor.
All right. So what we'll do is we have sent you a WhatsApp group link. You can join that. You'll get notifications on any other mocks that we conduct, and if we get
Okay.
more stuff, we'll give you as well. If you wish to do more mocks.
Okay. Yes, of course, doctor. I'd like to do more mocks. The
All
feedback
right.
was really helpful. Thank you.
Thank
All
you so
right.
much.
All the best.
All the
Thank you.
best. Thank you.
Thank you. Bye, doctor.
Bye.